the saying, it's all in your head. Well, sometimes it really is. In this morning's Weekend House Call, WDSU medical editor Dr. Corey Hebert will help us rein in on hypochondria.
You always hear me talk about physical illness, but I've never talked about hypochondria. The American Psychological Association claims 5% of all U.S. adults suffer from hypochondria. Hypochondria is a mental illness where a person worries and fears they're seriously ill, despite all contradicting medical evaluations and assurances. Hypochondriacs misinterpret normal bodily functions or minor health issues as a sign that something very serious is wrong. For example, a hypochondriac may misplace his wallet and become convinced that he's developed Alzheimer's disease, or a certain standard headache is really a brain tumor. Hypochondriacs tend to exacerbate their condition by obsessively consuming medical research, frequently checking their vital signs such as temperature and heart rate, and by regularly scouring their bodies for lumps, sores, or other problems. When doctors reassure them that nothing is wrong, hypochondriacs may go doctor shopping, looking for practitioners who believe that they're sick. Hypochondriacs also can get so obsessed that their work, family, and social lives suffer. And 60% of people with this condition also suffer from another mental illness, namely major depression or an anxiety disorder. Doctors find that a history of physical or sexual abuse may actually foreshadow hypochondria. Growing up with a hypochondriac parent or having a serious illness as a child is also a factor. Whatever the cause, hypochondria is tough to treat, as patients have a hard time admitting that their problems are mental, not physical. Talk therapy is the most common treatment for people seeking help. In therapy, patients learn how to change the thinking and behaviors behind their symptoms. Certain medications like Lexapro and Paxil and other antidepressants in the selective serotonin reuptake inhibitor class are also unhelpful. The goal of treatment is not to cure hypochondria, but help the patient live as normally as possible, even if the symptoms continue. With the advent of the internet, a lot of folks think that they may be hypochondriac. But if you or a loved one truly seems to suffer from hypochondria, make an appointment to see a mental health professional. I'm medical editor Dr. Corey Hebert with your Weekend House Call.